morning. From the class of 1973, we're going to ask Dr. Paulhart to come forward. He's a graduate of the first class of 1973. He practiced in Canada for 3.5 years, following training at further training at the University of Sick Children in Toronto. Following that, he moved to Massachusetts, where he had a private family practice for 32 years. Following that, he has done locums in both Canada and the United States to allow him time for volunteer work. And he has been awarded the Senior Volunteer of the Year Award by the Massachusetts Medical Society. So welcome.
Yeah, that's important.
Good. Well, this is comfortable. Thank you very much. It's a real pleasure and honor to be here and realizing now it's 40 years. Today I'm going to talk about medical volunteering in an area that I find very interesting and passionately involved in. There are no potential conflicts of interest that I'm aware of. And the learning objective is to just learn about medical volunteering and its consequences and perspectives. So what is medical volunteering? I guess we should start off with a definition. And if you go to the annual review of sociology, the definition is listed there as an activity which time is given freely to benefit another person, group, or cause. And this is in general. This is not just, of course, for medicine. And if you want to look at volunteering in general, who actually volunteers? Who are the groups? Who are the people? In 1991, in Europe, they did a European value study, and they tried to look at various countries around the world to decide who were the volunteers, how were they distributed as far as age, and what type of volunteer work. And they looked at all various sorts of volunteer work, not only medical, so religious or church, education, trade union, political, any area where one could volunteer in. And if you look at initially the American data, it's interesting, at 64+ million Americans volunteered in 2012. Many, many Americans. And that was $171 billion worth of volunteer work. And this work was divided into a number of areas, including fundraising or selling somebody to raise money, which was a top area. And they talked about collecting, preparing, or distributing food, which many groups do, labor, teaching. So there's a very large list of areas in which people volunteer. 47% of the US population volunteered. It's the same in Canada. But if you look at the rest of the world, it drops down 40% to less than 20% from Portugal through Great Britain. So most percentage-wise, here in Canada and the US is where most people volunteer, or more people volunteer. And I'm sorry you can't see this too well, but they broke down volunteers by age and sex. As you can see from the various curves there, that it rises around the 30s or so and then starts going tapering off as you would expect. By country, they list the various countries, with the top 2 countries being Canada and US, and some countries having hardly any volunteer efforts done by the folks. And then, so why do people volunteer? Well, initially there's the religious answers, and here we have 2 quotes from scriptures, Christian and Jewish. Another part of the Jewish scripture said that when you plow your fields, you should leave 10% of the produce or the whatever you're plowing for the needy. So there is a religious commandment, if you will, to volunteer. Sorry. And then why do people volunteer? So if you ask a group of people, why are you volunteering? Why are you here at this particular group? There are many, many answers given. And the common answers recognition, personal growth, giving something back to a community or a group, bringing about social change, family reasons, and friendship. And people can volunteer for a whole variety of reasons. Now comes what I find sort of the interesting data about volunteering. It costs money, but how much somebody makes seems to make little difference to whether or not people will volunteer. If a wife has an unemployed husband, she's less likely to volunteer, but not the opposite. Caring for kin is usually regarded as a higher priority than volunteering, but actually turns out that more people will volunteer than want to care for their kin. More time is spent volunteering than helping your own family. The more times that women invest in their housework, the more times they contribute to volunteer work, which is interesting. And the last one, which was from a Canadian study, the more that the government spends on volunteering, welfare, the more people volunteer. If a government lowers the amount of money it's spending on welfare, the amount of volunteering goes down, which would sort of be counterintuitive. You would think that people would want to step up and take over the shortage. Now, what about the health consequences? 8,000 teens showed that they had a 33% lower rate of pregnancy and 50% lower rate of school dropout if the teens volunteered. What other activity will half a rate of school dropout and give you a third the rate of pregnancy and lower the rate of suspension and course failure? Not many. So if you can convince school-age children to participate or volunteer in a program, there are obviously many, many positive benefits. Another teen study, which was interesting, found that only 3% are arrested in 4 years after high school in volunteers versus 11% in non-volunteers. So you're less likely to get in trouble with the law if you volunteer. And you found a better rate or higher rate of social well-being in volunteers versus non-volunteers. And a positive effect on life satisfaction and negative effect on depression in adult volunteers. So volunteering across the board has many, many positive effects. The elderly noticed that high volunteering, that is at least volunteering for at least 2 groups, had 44% lower mortality than non-volunteers. Which of our drugs lowers mortality by 44% with no side effects? Which activity does it with no side effects? And this is just asking that people volunteer. If you're over 65 and depressed, there's a very strong positive rate on depression for volunteers. And then how much should you volunteer? Is there a magic amount? And it turns out, yes, it's 100 hours. After 100 hours, it sort of levels out. What I did in my practice was I had established, because the United States does not have universal health care as we do here in Canada, a 2 free medical program. We gave out medication. So I asked some of my patients, people who were at risk, they didn't know that's why they were chosen, to come and help me. And they got together in my office at the end of the day and took the medicine that the drug companies gave us in large boxes and broke it down to small packets. Very simple, did not require any ability. It was amazing that this group of people who did not know each other over the course of a number of months bonded together. It became an activity that they looked forward to. They tried to convince other people to join them. and have marked positive effects. And I presented to them as, hey, I need help. If you can help me, please, rather than saying, I want you to get involved in the volunteer work to help yourself. So obviously in Canada, that's not an option because you have universal care, but in the States it is. And then they looked at, in 1999, one group, volunteering for a religious organization versus a more secular setting. And they found that religious context is a key factor in mental health over age 65. So if you volunteer through a church, synagogue, temple, whatever of some kind, it is more beneficial to the individual. So if you look at volunteering as an activity, there are many positive benefits. They are easy to achieve. The cost is relatively minimal or nothing for a lot of folks. And there's many areas they can volunteer in. And as far as a physician, it's something that we can encourage our patients to do. And if you do it, I think, in the right way, the patients aren't feeling that they're being coerced or forced. And you know, if you don't have a group, you can say, well, gee, this group which I am part of, or I support, needs your help. Would you mind? And it will work. Now, I've gone to many countries around the world, and what I thought I'd do for the second part of the talk is just show some pictures of some of the countries and talk a little bit about their needs. Nepal, it has, as many countries do, a lack of physicians and a lack of quality of care. This is one of their small, would be equivalent of a cottage hospital. This is the ward in the hospital. You can see and this is only taken a number of years ago. You know, the primitive quality of the beds. A lot of the bedding is brought by the patient, who also will bring the food. This is their delivery room. I think we can contrast it a little bit what they have here in the hospital. This is one of the wards. You know, no barriers, nothing between the patients. Families will come together often. As you can see, the family here, this family at the end here, where the one patient was had the wife and child visiting. I did a small procedure on somebody who had a lesion on the skin that had to be removed, and they had no surgeons to do it, but they had the opportunity, they had the facilities. This here, it shows the poverty that exists. There is limited government support for anybody who is poor or in need. The mentally challenged face major problems. This lady was just sitting in the middle of a large courtyard like this for the whole day. Little children would be, I don't know whether or not this child had parents, but this was just on the street where she was sort of playing around. And again, these folks, this is where Mother Teresa had established a site, and these folks were just sitting there being fed and basically waiting to die. Brazil is another country, and it's very interesting. Brazil itself is doing extremely well if you go through the south of the country. This is the Amazon. The Amazon has always been neglected in Brazil, although they've recently found oil. This is a typical vessel that you find that goes up and down the river. On the top deck, you bring your hammock, and if this was a commercial boat, you would string your hammock in a favorite position, and that's what you sleep in. And it could take 8 or 9 days going up the river to get to your community. On the lower deck is a small kitchen, bathrooms, and the crew's quarters. And this boat just goes up and down, would go up and down the river. What we did is we went up and down the river and held little clinics. One of the problems with the Amazon is it floods. It goes about 35 or 40 feet difference between the dry season and the height of the rainy season. And then sometimes, so even though this building is on stilts, you can see the watermark where it could just come down from flooding. And so these people either are forced out of where they are, or they put up some benches and live above them with the water in the bottom of their house.